This video is for general information only and is not a substitute for personalised advice from your GP, pharmacist, or a registered dietitian. Please do speak with a healthcare professional about what's right for you. Now, are you managing fatty liver disease, diabetes, or both, and wondering whether fruit is actually helping or hurting? That's a really common question, and the answer is more nuanced than a simple yes or no. Let's break it down. Non-alcoholic fatty liver disease, or NAFLD, affects around 1 in 3 adults in the UK. It's closely linked to type 2 diabetes, and the two conditions share a key underlying mechanism: insulin resistance. When your cells stop responding properly to insulin, it creates a cycle that can worsen both liver fat and blood sugar control at the same time. So what you eat genuinely matters for both conditions together. Now, fruit often gets a bad reputation when it comes to blood sugar because, yes, it does contain natural sugars. But whole fruit is not the same as a sugary drink or a glass of juice. Whole fruits come packaged with fibre, antioxidants, and phytonutrients that slow down sugar absorption and offer real protective benefits for metabolic health. The fibre in whole fruit helps support insulin sensitivity and prevents the kind of rapid blood glucose spike you'd get from fruit juice. So if you've been swapping whole fruit for juice thinking it's the healthier option, it's worth reconsidering that. So which fruits are the best choices? Berries are a standout. Strawberries, blueberries, raspberries. They have a low glycemic index and are rich in anti-inflammatory compounds, making them particularly well suited for managing both fatty liver and diabetes. Apples and pears are also great options, again because of their fibre content. Citrus fruits like oranges and clementines offer similar benefits and are widely available year-round. On the other end of the spectrum, some tropical fruits like mango and pineapple and dried fruits like raisins or dates are higher in sugars. That doesn't mean you can never eat them, but smaller portions are sensible, and pairing them with a source of protein or healthy fat can help blunt the effect on your blood sugar. Individual responses can vary too, so it's worth monitoring how different fruits affect your own glucose levels. One thing that's really important to understand is portion size. A standard fruit portion is around 80 grams. That's roughly a small apple, a handful of berries, or 2 small satsumas. This aligns with the NHS 5-a-day guidance. And rather than eating all your fruit in one go, spreading it throughout the day is a more helpful approach for keeping blood glucose levels steadier. There's also one specific caution worth highlighting: grapefruit. Grapefruit can interact with certain medicines, including some statins and calcium channel blockers. If you're on any regular medication, please do check with your doctor or pharmacist before making grapefruit a regular part of your diet. In terms of the bigger picture, NICE guidance is clear that lifestyle modification, including a balanced diet, is the cornerstone of managing both NAFLD and type 2 diabetes. A Mediterranean-style approach which emphasizes whole foods, healthy fats, and controlled carbohydrate intake has shown real benefits for both liver function and metabolic health. Fruit fits well within that pattern when chosen and portioned thoughtfully. If you're managing either of these conditions, it's worth having a conversation with your doctor or a registered dietitian about how to structure your diet in a way that works for you personally. And if you notice any new or worsening symptoms, significant fatigue, abdominal discomfort, or changes in your blood sugar readings, do contact your healthcare professional rather than adjusting your diet or medication on your own. So to recap, whole fruits, especially berries, apples, pears, and citrus, can be genuinely beneficial. Fruit juice is not a like-for-like swap for whole fruit. Portion size and timing matter, and grapefruit needs a specific check with your doctor if you're on certain medicines. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, please do like this video and subscribe to the Bolt Pharmacy channel for more evidence-based health content.